With the rising COVID-19 numbers here in Arizona, hospital beds, they are filling with patients, coronavirus patients specifically. But what are medical professionals dealing with right now in hospitals right here in our state? Dr. Stephen Maher, president of the Arizona College of Emergency Physicians, joining us live this morning. Doctor, thank you for being here.
Hi, thanks for having me.
Not an easy time to be in your profession. Tell me a little bit about what Arizona physicians are facing.
Well, we are seeing the numbers on the rise, obviously, and we're seeing our ICUs getting closer to capacity, as well as our emergency departments getting closer to capacity at this point.
And we watch the numbers from the state. How alarming is it to be at the upper 80% of ICU capacity? It looks like, there are rooms left, they have alternate plans, but what does that really mean for someone like yourself?
Well, I think that we all need to do our part to try and slow the spread. I think that it is getting tighter than what we've seen it before. I think it's pretty close to capacity in most places around the valley and the state, but yet we still do have some rooms available. I think that if people can try and observe social distancing and wear masks, as we would request them to, that would be very helpful, especially because our younger population seems to be gathering in masses and not really obeying those social distancing and mask wearing conformities, and they end up being one of our largest spreaders of COVID-19.
Doctor, you're on the inside. So, for the benefit of our viewers, if 88% of capacity isn't alarming, what number is?
No, I do think it is alarming, and I do think we're close to capacity, and perhaps our ICUs are even maybe a little bit busier than that number in actuality. We definitely are concerned, but we are lucky in a way that we've had 3 months. Unlike New York City, we had 3 months to fine tune our surge plans. We've been able to mobilize resources, and we've been able to have AZGHS set up a surge line where they can help us get COVID patients to the proper ICU. If the hospital that they're at does not have an ICU bed available, they're able to get them to an ICU bed, and that's very helpful as well.
Being in the emergency room, challenging enough as it is on a day-to-day basis, how are your challenges different now in the face of coronavirus?
Well, I think that having to put on and take off the PPE, and to do that when a sick patient comes in, that we have to get it on quickly and get it off eventually. But that just makes a little bit of an added difficulty. But it's something that we're all getting very used to as the third month of really doing this full tilt.
We've seen the sad stories. What about the resilience and the mental health of people that are working in these situations in the emergency room? What as a community can we do to help them?
Well, I think the support has been great. All the things that people have done to support the frontline workers has been wonderful. That we really appreciate that. I think by and large, our whole team is a very resilient group of people, and I'm very proud of our community. As our emergency workers have been statewide, have been really, we're all in the same boat, and we've been doing pretty well as far as banding together and really working as a team to work ourselves through this process. I think the one thing that I do feel some concerns about, as well as our older population or at-risk population, as well, are people with multiple medical conditions and people over the age of 65 and people who are immunocompromised, meaning either cancer patients or people who are on immunosuppressive drugs. I feel like they have to socially isolate, and therefore they are very become isolated, and that's not good for their mental health. And I think we really need to reach out to those people, either by more frequent phone calls or video chats to those people, to kind of boost them up.
That's good and important words. The vulnerability is certainly extending past the physical. Dr. Stephen Maher, thank you so much for your time this morning.
Thank you very much.
Thanks.